Welcome to Talk to Your Health. I'm Dr. Derek De Silva. Last week, we addressed a growing epidemic here in the U.S., obesity. This week, we're talking about when bariatric surgery should be considered and what type of options are available. Once again, joining us is Dr. Seun Sowemimo of Prime Surgicare and Central Jersey Bariatrics in Freehold. Thanks once again for being here.
You're most welcome.
So, when should someone start thinking about bariatric surgery?
When you fall into the category of severe or morbid obesity, a BMI above 35, with associated diseases like diabetes, high blood pressure, sleep apnea, or when the BMI falls above 40, you should really consider bariatric surgery.
So what are the options? There are all kinds of different procedures, and we're going to bring a graphic up to show it says. Yes. And what we're going to do is, would you just comment on these as they come up and
Yes.
tell us what are the options? Let's start with that.
Well, the three main options that we provide are the gastric banding.
Here we go. Is this is the band?
Yes, this is the band. This is the procedure that the governor had. This is where we use a medical device and put it on the top of the stomach, creating a small stomach above that medical device, which becomes the functional stomach.
Okay.
When you fill up that small pouch of stomach above the band, you feel full.
I see.
And slowly the food empties into the rest of the stomach and then undergoes the digestive process as usual.
Okay. Next one. What's this?
So this is the gastric bypass, and this is the one that's been around for the longest. This is a situation where we actually create a gastric pouch using a stapling device, and that reduces the amount of food you need to feel full, to fill that gastric pouch up to the brim. Other things that come into play here is that excluding the other portion of the stomach reduces a hormone ghrelin. Thirdly, bypassing some of the intestine creates a little bit of malabsorption that adds to the potency of this procedure.
Okay.
And another thing we're finding now is that the gastric bypass increases your metabolism and your metabolic rate.
And the next one,
helps you
we've
to
got
get
one
rid
more.
of weight.
We got another graphic that we're going to, what is this?
Now, this is the most recent procedure that we're doing a lot of now. It's called the gastric sleeve. In this procedure, we divide the stomach, creating a banana-shaped, banana-sized stomach that also restricts the amount of food you need to feel full. Also, taking out the other portion of the stomach removes that hormone again, ghrelin, which in latest studies showed that people who are obese may produce more ghrelin than the normal population.
Right.
So taking out that portion of the stomach reduces the ghrelin, reduces the feeling of hunger.
You know, there's so many options out there. I think people need to become aware, and they need to start searching people like yourself out early before all the comorbidities and the diabetes and all of that stuff happens. So once again, thank you for joining us.
You're welcome.
Been a pleasure to have you with us.
Thank you.